Okay, here we have Kristen, and just about a couple months ago, she came in with some severe degenerative disc disease and lumbar spine pain, and we decided to do some laser stem cell signaling. And so, Kristen, what was the back pain like before we started the procedure, and what is it like now?
Uh, well, it's so hard to describe. Um, it was, I don't know how to, it was a tightness. I still have some, what I call stiffness,
Uh-huh.
stiff. And before it was, I really can't describe the pain of it. It was, but a lot of the pain I have is that sciatic pain down my right leg, the right, what feels like the right hip to me. And then some pain down the side of my leg. And that's better. But I still have that. And I still have mostly like a lot of stiffness, a weakness in my legs. It's more than pain. And then it just that makes it difficult to walk. Before that, it was like that, but worse, I guess. It's really hard to
So
explain.
2 months later, well, how long have you been dealing with this pain, first of all?
Oh, well, many, many, many years, but I had the surgery in November of 19.
Was that a laminectomy, or did they take
That,
out a,
yeah, that plus they replaced one disc. The one on the very bottom, they couldn't get to. So that is still crushed in there.
so they actually put an artificial disc in the L4-5?
Yes, they did.
Okay. And did you get any pain relief after that?
It took a long time. I'm telling you, it took the whole year to even recover from the surgery at all.
How long ago was that?
The main time, well, the surgery was November of 19. So last
Okay.
November was a year. And then I saw you about a month after that.
So you really didn't get any significant improvement after the disc replacement?
Well, not in the back, but it did before the surgery. I had really severe sciatic pain all the way down both of my legs. It did relieve that.
Okay, except for that one side. All right.
The other thing, it's kind of in a different place. It's hard to describe. Again, I felt that right after the surgery was done. It was more intense then. It feels like my right hip, and people tell me that it's not my hip. And then the pain goes down kind of the side and back of my leg. It's
Were
kind
you
of
told eventually you're going to have some screws put in your back called lumbar fusion?
I have screws. They put a couple of metal plates and 5 screws in my back and at the surgery.
At the same time as a disc replacement. Okay.
Yeah.
All right. So here we are 2 months after your procedure that we did with the laser stem cell signaling. I know you said it was kind of hard to put a number, but can you repeat about what percent improvements do you think you've had in just short 2 months?
Well,
you already wrote it down. Yeah.
I put 45 today, but I'm not really sure that that's true. I would say maybe between 30 and 40.
Well, that's still,
it's still good.
It's still double what we expected considering the failed surgery and the chronic pain you've had many years. I was estimating about 10% improvement a month. Here we are 2 months later. You said you're 30 to 45% better. I'll take those odds. Yeah.
Okay.
So like I said, it's not going to get better overnight. So I said it took years for your spine to regenerate. And now you have hardware we have to deal with from the failed surgery. Give it a year to start regenerating back, right? So we're going to give you some maintenance treatments today, some very gentle laser, some shock wave to keep the cells stimulated. And then we'll have you come back another a month or so for another reevaluation, okay?
Okay.
All right, so just wait. I'm going to text Melissa your instructions and we'll go from there. I'm also going to add a supplement to your program called a peptide. It's basically sequences amino acids, basic building blocks to help rebuild the spinal components, the discs, the muscles, tendons, and all that, okay? It'll really accelerate your healing, okay?
Okay.
All right. Okay,
Sounds
we'll see you in
good.
about a month then, okay?
Okay.
All
Will
right,
do.
bye-bye.
Bye now.